My name is Tarkten Pharr, and I'm a vascular surgeon with Carolina Surgical Care. The public is much more cognizant about cardiac disease than they are about peripheral disease, but this is just the same disease process manifested in other areas. And so very commonly it's expressed in the neck and then in the legs. In the legs, very similar to the heart, if the heart outstrips its blood supply, there's chest pain. And there can be leg pain if the muscle groups of the legs aren't getting enough blood flow. And that just is a reflection of how wide open is the circulation to that muscle group or groups in the leg. And so people who have no problems with peripheral arterial disease have no problems or limitations walking. If you do have some kind of plaque burden that's limiting the amount of blood flow that gets to your legs, you will feel that over a certain period of time. And it may be not very noticeable at first, and then it may progress along that continuum to the point where you can walk only a very short distance before you can feel that. The most common risk factors for this, again, is the same thing as risk factors for heart disease. It's high blood pressure, cholesterol problems, diabetes, or smoking. Most commonly we start out trying to get people better with medication or an exercise regimen, exhaust all conservative measures before we would think about doing something else. In the arteriogram suite at this hospital, we do a variety of peripheral interventions. The capital upgrade to have that room was made with the idea that we can go ahead and treat peripheral arterial disease on par with other institutions. If you think that you have peripheral arterial disease, I would encourage you to contact your primary care physician, because they would be able to order an appropriate non-invasive test, no needles, no radiation, something that wouldn't be too uncomfortable to see if this is indeed an issue for you. It's a good screening test, it's inexpensive, and it's a great way to glean whether there's indeed something that we could or should be doing more aggressively for you.